Hi, my name is Mary Wong. Welcome to Fertility Talks. I didn't even know I was going live. I thought it was going to count down. Here we are. Welcome. I'm so glad you're here, Melanie. This is Melanie Mitchell, everyone, and I'm so thrilled to have her because today we're going to talk about tips on injections. So obviously this is for the people that are doing IUI, IVF, where we need to use injectables. So before we start, I'm just going to tell you a little bit about Melanie. She really knows her stuff because she's been around for ages. I'm just going to read in a good way. Okay. Around for ages in a good way. Okay, so Melanie Mitchell is a mother of 3 and has been registered with the College of Nurses of Ontario since 1998, with a primary focus in women's reproductive health since 2001. She has held a variety of nursing positions ranging from an operating room nurse to nurse manager in some of the top fertility clinics in Toronto. We won't name the names, but I think you've been almost everywhere, really. So
yeah, almost.
Okay. So in November 2016, Melanie established Your IVF Nurse Consulting to assist those navigating through fertility journey, and a variety of services offered, such as fertility coaching, accompaniments to appointments, and procedures and injections. So I'll let Melanie tell you exactly what that actually means. But before we actually start, I want to let you know that Melanie did do injections for myself when I was at the fertility clinic with one of the clinics I was at. So that was kind of cool. And as we were just saying, we know each other quite well because we
poked each other. Mary was the first one to actually do acupuncture on me for the very first time. So it was interesting.
So we've been poked by each other.
We're both benefiting from our services and skills.
And so today, I thought she was going to bring some needles so we can literally do some live poking. But I guess she was sparing me and my body. But what we'll do is we'll just show you guys injection sites where it would work to deliver the hormones, as well as, make it less painful. And you'll go
I'll give you
about
some
that.
tips.
Okay, cool. All right, so the very first question: what do you advise patients to do when they're preparing for a procedure like IVF with regards to the injections and medications?
So one of the first things I always advise patients is to make sure you've got everything you need. A lot of the times patients, they have their medications covered through insurance. Medications are really expensive, so rather than buying them from the clinic, they'll ask for a prescription, go get their medications filled. However, the pharmacy may not provide all of the supplies that you need, so the needles and syringes. So I've been on the receiving end of phone calls saying, I can't mix my meds, I don't know how to inject them. Depending on the medications, if you're getting a pen of some sort, usually in the actual pen itself, it'll have the needles. But if you're mixing combinations of FSH and LH medications, so things like Menopur, Repronex, those things require needles and syringes and Q caps or mixing needles. So you want to make sure that when you're picking up your medications, if it's from a pharmacy, that you've got everything. And I always say, if you're doing that, bring it into your nurse at your clinic, sit down with the nurse, make sure you've got enough for however long of your medication. Make sure you don't run out of your supplies. You always want to make sure you have extra supplies, because you don't want to be getting that email or phone call saying start your meds and you can't do them. Or you're kind of troubleshooting and saying how do I inject this? Or where's my needles? I thought I got everything. So it's to have a nurse with you, or to have access to a nurse, because some clinics do have an after hours line where they can talk you through to troubleshoot if you have some of the supplies but not all of them. But you have to be really crafty, and I think a lot of the times when patients are first starting their injections, it's really overwhelming. So making sure you've got everything and making sure that all of your supplies, medications are stored as per manufacturer instructions is your first step.
Well, and I actually have to add in though, so people are even shown sometimes at the fertility clinics, but one time.
Yeah.
So you're overwhelmed with all the procedural stuff going on. So really, how well does it go into your head? Not very well for most part.
No, exactly.
Right?
A lot of the times when I'm doing instructions with patients over the years, there are a lot of little tools that are actually given to you, but if you don't look through your supplies, You're never going to know that they're there. Years of doing this when fairing, which makes Menopur, can I say that?
You're allowed to say that because these are all commonly used drugs.
So what happens is that when you pick up your Menopur or your Repronex, you should be also receiving a supply kit with your syringes, needles, Q-caps. When you open up that box, and I was thinking to actually bring one today, but when you open up that box, on the left-hand side of that flap, if you go through that flap, there's actually like a placemat, and it tells you to, it shows you, you take one syringe, you take your vial of diluent, your sterile water, you take your powder for mixing, you have your injection needle, your Q-cap, so it lays everything out for you. Most times when people...
Okay, wait. Before we go on, so I just want to let people know that. So sometimes when you get the meds, it's not like, some people may think that everything's ready to go. But it's not.
It's not.
Because you actually have to mix the powder with the liquid and then like go from one syringe to the other before you inject.
Yeah.
Right?
Yeah. And you're switching needles or screwing off Q-caps or big needles into small needles and vice versa, or different size needles.
Yeah, so if you're not even in the place of actually doing IVF, this is what you're going to be looking forward to. And you pay good money to be doing it by yourself, which is kind of funny, right? Like you're not trained at all, and yet you're expected to be able to do this.
Like you were saying, you will get like a demonstration from the nurse that's going to be working with you or one of the nurses on the team. And the thing is that we do this day in and day out. So one of the things, and it leads actually into the second question about what would be another tip, and it's when you see the nurse do it, literally, I would never do it, but I could probably do it with my eyes closed because I've done it so many times, and I can do it probably within 10 seconds, mix all of your meds and give you all your shots within 2 minutes. However, when a patient goes to do it, I always say give yourself enough time. Take your instructions if you need to before you're sitting down to do the injection. There's videos. All the manufacturers of the drug companies will have links. Sometimes you have to enter in the DIN number, so there's a drug number, identification number on your medications, and you would upload that into their website, and it should lead you to a video. If not, there are videos on YouTube, and I know that because I've done them. I've done them. You'll find me on YouTube.
All right, perfect.
Yeah.
So why don't we do that too? Like we'll give them your links to.
Sure.
Yeah, I think that'll be great. And I'll probably want you to come back live and maybe do different ones so that people can see.
Okay.
Right? Maybe we could actually get a drug company to donate because otherwise we'd just be wasting.
I know.
Very expensive drugs, guys.
Yeah.
Right?
Or even because a lot of the times over the years I've seen that when drug companies when you order the medications, they will actually, for the nurses to be able to demonstrate, they give like demonstration. So it's not really medication. Like it'll be, if you're doing a demonstration with a pen that requires a cartridge or it's preloaded, it won't have the medication in it, but it'll have a liquid in it. So you can get the feel of what it's going to be like when you press it to inject it, and it just gives you a better understanding of what you're going to feel, what you're going to experience, those kinds of things.
And so here's the thing, guys. A lot of people will choose to do this even when they're crazy needle phobic because you want a baby so bad you'll do anything to get it, and you'll inject by yourself. Or sometimes, like when I was going through it, I actually wanted my husband to do it because guess what, at the end of the day they don't do a heck of a lot except spit in the cup at the end. Like that's all they do. Let's go into the room, give you a little sample, and you do your thing, right? And that's it. So I'm like, no, you get to participate. So I wanted my husband involved, and he was the one that did the mixing. Of course, I had to watch over him to make sure he was doing it right.
Yeah, it's true.
Right? And then, and I would let him do the injections. But again, it's really individualized because some women would never trust their husbands to touch them with a 10-foot pole with a needle anyway.
It is true. I've seen that where when I'm working with a patient, they literally, like you said, they don't trust their husband. And then a lot of the times the partner doesn't want to hurt them.
Yes.
So when you start talking about certain side effects when you're doing the injection, it's, if you're receiving the injection and you're going like that because it might sting or burn, and some of these meds they do when you're doing the injection, then it's kind of like, or if you bruise your partner, then you're kind of like, I feel really bad. So a lot of the times it's left up to the person who's going to be having the egg retrieval to do the injections. A lot of the times what I do, I try and involve the partners as much as I can. So if I'm doing a home visit to do injections, I'll always ask who wants to mix the meds. And I've had patients that they don't want to mess it up, so they're like, absolutely not, and that's fine. But a lot of the times I think some women, they might not want their partner to poke them, but they want them involved somehow. So whether it's mixing the meds, or she mixes the meds and he does the needle stick, or he holds her hand while I give the meds and goes and gets the ice pack after to avoid any bruising or whatever. So, and I had one client and same thing. It was every night, that's all he did. He sat by her while I mixed, because he refused to mix. And he went and he got the ice pack for her. He held her hand. We did the shots. And that was it. He just kind of comforted her and said, you're doing great, and look what you're doing for us, and this is going to, be worth it in the end. So
crazy.
Yeah.
This is what we do, guys.
Yeah. Yeah.
Yeah. Okay. So then with all that, what's like the one takeaway tip that you want to share about injections?
They suck. I don't think anybody goes into thinking, and this is one of the things that I think a lot of the time is lost when you're starting this whole journey and going through the process. Like, you don't go into your doctor, or you don't get married or find a partner and think, or even if you're single and think, I want to have a baby, and think, well, depending on how you're going to go about it, but you never really think, I'm going to have to do injections. I might have to do insemination. I might have to do an egg retrieval. Like, all these things that when you're growing up, you're never really taught about how difficult it can be. So it's kind of like, it sucks. You try to make the best out of it as much as you can. Sometimes you can't. And that's okay, because it's a hard thing and you're injecting hormones and it's normal to be emotional and there are side effects. But one of the things, and something I always pride myself on, is that the nurses are there to help you and to support you. So if you have access to a nurse, that's who you want to be able to reach out to if you've got questions, if you've got concerns about your injections, how you're feeling. I always tell people, anytime, message me, call me. When you're in my program, you get access to me whenever. So it's kind of like any concerns you have. And because I've worked at many of the clinics, I know everybody, so all the nurses, and it's kind of like it's been beneficial for me, and indirectly it helps patients. So if I have anything where I need to reach out to a fellow nurse because one of my clients might be having issues, but there's a whole heap of consents and patient sharing information and all that kind of stuff that has to be signed in order for me to work directly with a patient. But it's kind of like, when you're doing your injections, you want to be comfortable, you want to be confident, you want to know you're doing it right. So taking the time to do it, and if you have questions, use your resources. So if you've got access to an after hours line, call if you have questions. Some of the after hours line will redirect you, but most times when you have an after hours line that's affiliated with a specific clinic, there'll be a live person on the end that can address any questions you have. They can talk you through. Not all clinics offer that service, but in those cases, they may have alternate resources that you can use. But being confident and knowing that if you need extra time to sit with your nurse will do it. You just have to ask.
That raises a good point, because as you know, for those of you that go through the fertility clinic, you often feel like you're just, like cattle. And there's so many women going through this that you don't feel like you have time with the doctors, nurses, admin, anybody. And it's a tough thing to navigate. So, you can advocate for yourself and say, hey, I actually need some time, or, right? And,
True.
and not be shy about that. But I think a lot of people don't say anything.
They just kind of fall into the crowd and think this is how it's supposed to be. But you make your experience how it'll eventually end up, if that makes sense. It's kind of like, if you're coming in and you've got questions and you actually say, you know what, I'm a client, I'm a patient, and I have these questions and I want them answered. If you say, you know what, can I speak to a nurse? I have some questions. I want to see how my cycle is going. I want to see how the progress of my stimulation is going. can I wait to speak to someone? Can I make an appointment? However your clinic will do it. You just have to be able to kind of speak up for yourself and say, I want some more information.
Except, sometimes, people aren't even in a position to know what to ask either. So
which
it's
is very
learning
true.
what to ask as well is there. So I think that's great guidance. I love that. Now, I want to get into the meat of this. And like I said, maybe in the future we'll do actual full-on, mixing and all that stuff so you guys can see again. But I want to talk about injection sites. So for stimulation drugs, to show you exactly where you're going to do it. So I'm going to be the guinea pig, and I'm going to show you my belly. I ate dinner, so, mind my bloat. And I put my pajama bottoms on for this reason. So I'm just going to kind of stand up, because otherwise you're not going to see my belly.
Yeah.
Okay?
Okay.
And
my hands are cold, so I'm sorry.
Oh, that's okay. They'll be like anesthetic.
Numbing, exactly.
Okay, so we'll show my belly. Belly.
Okay. So when you're doing your subcutaneous injections, so a lot of the times medications, a lot of the doctors now are moving forward with saying, all these injections can be done subcutaneously. So into the layers of the skin or the subcutaneous tissue. So I'm sorry, Mary.
No, it's okay.
Ideally, what you want to do is take your belly button, and it's 2 to 3 fingers.
Oh, so I'm going to have to go this way so
on
you can see.
Either side. So going this way, but away from the belly button. And you want to alternate your sites. So one day on here, you do all your injections. So whether that's 2 or 3 or 4 injections. And then the next day, you'd give yourself a break on this side and you'd go this way. Now, when you're doing your injection, depending on how much skin or you have, what you would do, you're going to landmark and say, okay, 2 to 3 fingers, we're going to go here. We're going to pinch the skin just a little bit, clean it with alcohol, and then your needle is going to go in. Now, if you've got a lot, I have a lot, you don't have that much, so you would probably go in on a 45-degree angle. But someone who is a little bit heavier like myself, I could go straight in. The needle is quite small, and you just want it to go into the subcutaneous layers of the tissue. Bruising is normal. Itching is normal. Redness at the injection site. Sometimes people will see that they bleed a little bit. If your protocol includes ASA, so baby aspirin, you're going to find that you bruise and bleed a little bit more. You just want to gently apply pressure after your injections. If you're finding that you're bruising, you can also put an ice pack before.
And then so, you want to be below the belly button.
Yeah.
And how low can you go?
Anywhere where you can kind of pinch. From what I've been told by patients, this area right here is actually very, very sensitive. I find people that go here where their pants rub causes more irritation. So I would say anywhere here. Okay. I've seen people, larger people.
So from the hip bone
going
inward.
2 to 3 fingers.
2 to 3 fingers out.
Going out. So maybe like these areas here going down.
Okay.
On either side. But like I said, if you find that your pants are rubbing on your injection sites, depending on if you were low rise, high rise, whatever, then you would kind of just adjust to where you're doing your injection so that they're not being bothered.
Right.
Yeah.
Oh, these days I think people are wearing high rise pants now.
I think so. Yeah.
That's the
fashion changes.
Fashion changes, yes.
Yeah.
So, okay, and then how about, why don't we touch like the progesterone butt shots?
Okay. So
I'm going to show you my butt, guys.
So for progesterone, ideally what you would do, if I'm going to just turn you right around, Mary. So
okay.
This is Mary's backside. And what we're going to do is half her bum. So half, and then you're going to take the one half that you have that she's got exposed, and you're going to just kind of score it so that you're going in the upper outer quadrant. So this area in here is where you're doing the injection. Now, that's if your partner's doing the injection. I find that some people will do their own progesterone injections. Yes. So in that sense, and this is one of my favorite places to landmark, is your ventral gluteal. So if you take the palm of your hand and you find this hip bone here.
Okay, so yes.
And you're just going to go.
So this hand.
Yep.
So the opposite hand,
the opposite hand, the palm of your hand, like the base of it, place that on the bone, and then you're just going to make like a right in here. So that way, literally, if you're doing your shot, you're not having to twist and go back this way.
See, I never was able to. No one told me that trick.
Yeah.
Okay, guys, that's
one of
way
my favorite
easier.
ones. And there's
okay, that
if you were to like Google ventral gluteal, it'll show you different landmarking on how to get that exact spot.
Oh no, this is great.
Like essentially though, you've got the two muscles and they overlap, so you really have a good chunk of space. And even with progesterone, you would also alternate your sites.
Totally.
And don't do this in your thigh.
No.
No. So being an intramuscular injection, ideally here, I always tell patients as well in the mornings, because you want that motion throughout the day that helps to loosen those knots. Cool compress before injections, warm compress after. And I always say warm compress after and several times throughout the day. Like if you're sitting down watching a movie, take a warm compress, put it on your sites.
Right,
10,
not just
15 minutes,
at the time of...
Not just right after the
yes,
injection.
okay.
And I find that helps a lot. And a lot of the times, depending on your oil base for progesterone, so the castor is the thickest of them all, which is really kind of old school, but if you're having a reaction to one of the other oils, then you maybe switch to castor oil.
Okay, wait. So here's the thing, guys. So we were talking about different kinds of injections, and when it comes to your stimulating drugs, it'll be thinner gauge needles because it's in alcohol, right?
So it's the consistency of like water. I think.
Yes.
So it's very thin.
Yes, it's thin.
Yeah.
Versus when it's in oil, you need a thicker gauge
It's
needle.
like taking vegetable oil or olive oil from your cupboard and injecting that into you.
Literally.
That's the thickness of the consistency of the progesterone. Now, there is a newer progesterone that is actually based in ethyl oleate. And ethyl oleate is the consistency of like liquid. So it goes in a lot easier, and you can actually use a small, like an 1.5 inch needle, but the gauge of the needle is smaller. So it's not as big as what you would need for like cottonseed, sesame seed, or castor oil injections.
I think, how old is this one?
Probably, it's really come out in the last 5 years.
I feel like I did that.
You may have. Not all clinics.
That long, but okay, anyway.
Maybe 8 years, 5 to 8 years.
Okay, because when I did that one, I hated it because...
It burned?
It burnt, and it left... I feel like I had more pain and more...
Some people do. Some people do.
More welts from it.
Some people will. The way that people react to the medications can be so different from one person to another.
Absolutely.
A lot of the times, if you've had a previous pregnancy and you've used a certain form of oil, the doctor will get that specific oil for you. But if you've never done progesterone and oil, they might say, well, this one, usually about 80% of the times, is more user-friendly and you get less reaction from it than you would say the other oils. So like sesame seed or cottonseed or even the castor, because it's really hard to inject.
Well, castor is so hard to inject because it's like molasses, you know? Yeah. Okay, good. Cool. Let's see. So you talked a bit about local side effects, and I've certainly seen some people with hives too, and they'll still continue, right?
Yeah. So depending on the side effects that you have. So if you're having hives, and depending on the degree of hives or your allergic reaction that you're having, the doctor might say just take some Benadryl or topical Benadryl if you're only having like the hives develop at the injection sites. So anything that I always stress to patients, so anything that you think is normal, not normal, if you're concerned with it, ask your clinic, because you want to make sure that you're not having a symptom that maybe no one's ever had before, no one knows about it. So you'd need to isolate it and say, yes, it's directly related to this, or maybe we don't know, we'll just have to suffer for a couple more days until we trigger you, and then that's it. But you want to keep your clinic aware of what you're experiencing in terms of any side effects that you're having. So things like local reactions are very normal, but if you're having large bruising, if you're taking aspirin or Fragment, any kind of blood thinner, you're going to have bruising. But if you're concerned with your bruising, you can always show it to the nurse. Any reactions that you have from your injections, show it to your nurse. Progesterone is one where I've seen some really bad reactions, where it's either full body hives and you have to come off the progesterone or switch to a different form. I've seen sites become like cellulitis, so they're red, they're hot, they're inflamed, itchy, they're very tender, you can't sit, you can't lay on that specific side, it gets really bad. So those things have to be evaluated by your physician. So there's a lot of things. So one of the things, like I said, anything you're concerned with, no matter how small, and I say this to everybody, if you're going to ask a question or be concerned about it, somebody else is going to ask it or have the same concern somewhere. You're not going to be the only one.
Well, and again, people get shy and scared of asking questions. And I think, one of the main points is that you need to actually speak out. Okay, guys? Yeah. So thank you for that.
Yeah. Mm-hmm. I'm always a big advocate, and I don't know how many doctors are fans of this, but I'm one of those nurses that will say to any of my clients, whether it's been in clinic or in my own private consulting, but I say to them, if you go into the clinic and you've got questions and you think, oh, I forgot to ask the nurse or I forgot to ask the doctor at my appointment, write it down. And then when you go the next day or when you're following up, you bring that piece of paper with all your questions and you go through them and you ask your questions until you think you've gotten the answer that you need.
So, guys, when you watch this and you take your notes and you bring your questions, you can blame it on Melanie.
I know. Say the nurse.
And just say the nurse. Yeah. The nurse told me to ask all these questions. Then you don't feel bad about it. That's how it's going to go. So, is there a way to limit the number of injections?
It really depends on the clinic that you work with. So manufacturers will say, so the drug companies will say absolutely not. Because it's usually 2 different drug companies, 3 different drug companies that they're working with to stimulate you. So they can't say, oh, the interaction is safe for your cycle. However, I have worked in many clinics and I've worked with many clients where their clinic has said, yes, you can mix things like Gonal-F and Menopur into one syringe and
which is amazing.
It.
I had to do them all separate back in the day.
But a lot of the times clinics are like that. There are only 2 clinics that I know that will say, yes, you can mix them. But most clinics will say no. So you want to follow your clinic's instructions. So if they give you the go-ahead, it's because they've done enough cycles where they've mixed or they've had their patients mix the medications and there's no different in the cycle, or there's nothing that's happened to jeopardize the cycle outcome. So they're responding well and they're like, go ahead, mix. Most clinics will actually say, no, everything has to be completely separate. And some clinics will actually still inject their stimulation medications. So if you're mixing Gonal-F with Menopur, those are the clinics that will say, do it intramuscularly. You can do those subcutaneously as well.
You need to speak lay terms.
Oh, okay. So doing the big needle here, you can mix it in. And so an intramuscular injection is the needles that we were discussing about, the progesterone and oil. So it's a larger needle in the butt. Whereas the subcutaneous injections are the small needles that go into the tummy or the thigh. There has been some discussion about, can I do them in the thigh? You can. Probably about 75% of patients that I've worked with will only think of doing it in the tummy. And it's rare, I find, that people say, yeah, I'm going to do it in the thigh. And I find those ones that do it in the thigh only do it in the thigh. They won't alternate between the tummy and the thigh.
I think I'm going back years now, but I think I did some, and in fact, I think back then they told me to alternate different places just because it's like you're running out of spots.
We normally will tell you that as nurses to alternate your sites, but for the 10 days or 12 days that you're doing your injections, a lot of the times people will just do them in the abdomen and just alternate sites, or they'll do them in their thigh and they'll just alternate thighs. Whereas you can theoretically do your thigh, your abdomen, thigh, and just kind of do that and just do that for your entire cycle if that's what you choose. But I find people are kind of fixated on, let's do them in the abdomen because it's closer to the ovaries.
Yes.
Right? So it's kind of like...
just psychologically, it makes more sense.
Yeah.
Yeah, for sure. So the question then, people kind of panic. Let's say once you actually have an IVF transfer, and then they worry about the progesterone shots and doing heat. Do you get what I'm saying? They're like, oh, because, you're not supposed to take a hot shower, so is it okay to have heat on my butt?
But the theory behind the hot shower is that the hot water is going to be running over your body. It's going to increase your internal temperature.
That's right.
Whereas if you're taking a warm compress and just applying it to the site, I don't think it's going to affect...
It doesn't.
...entirely over.
No, I tell people this, but I just wanted to hear from you.
So, for me, I'm like, you can take a warm compress and put it there. Your body, you're not going to take something like a magic beanbag right out of a microwave and apply it there. because it's going to be really hot. You're going to burn yourself, even if you have it wrapped in something.
Well, it depends on how long
you do it, right?
Yeah.
How long you're nuking it for or whatever. So when you take it out, you're touching it to see, oh yeah, okay, that feels okay. And you're going to wrap it in something before you apply it to your skin. So it's going to warm the area. It shouldn't burn the area.
No.
And it's not like a hot shower that's going to make your skin turn red.
Yeah.
Right?
Well,
everywhere to increase your internal body temperature.
No.
So
And
those
it
are the
doesn't.
things when they say that embryos are hot and cold sensitive.
So,
Everything with a grain of salt.
and listen, guys, we have butts, thick muscle,
Exactly.
plus fat on top. We're good.
Very
So
true.
don't worry about applying heat on your butt. That's the bottom line.
Exactly. You'll need it. You'll benefit from applying the warm compress.
Totally. I remember. When you're talking about side effects, I remember I called them my butt shelves because they literally were sitting there. I felt like I had elephantitis. They'd stick out, and it was literally there for a year and a half.
I've heard people saying, exactly. So they've had their babies and they still feel the lumps.
Yeah, it's crazy.
Yeah.
Yeah, they were giant. But this is what you do. We're crazy.
The things that we do.
So thank you so much.
Oh, you're very welcome.
And we'll definitely do it again, and we'll actually show some mixing, but if you can...
Yeah, no, that's not a problem.
Okay, great.
Yeah, we'll arrange that.
Thanks, guys, for
All right.
watching, and have a great evening, and next Wednesday we'll do another Fertility Talks, and if you haven't done so already, scroll down, like my page. There's over 100, I don't even know how many interviews I've got so far now, but we're going to keep it all going because this is what I do, and love my guests. So thank you so much for
Thank you for having me.
here, and this is so awesome because I normally don't do it live, right? And like she came over to my house.
Because I live down the street.
Because it ended up she lives down the street. Too much information. We're not going to tell you where we live. Don't want you guys knocking on our doors. Hey, how do you do this? But you can get in touch with Mel. So can I call you Mel? Do I call you Mel?
Yeah, everybody calls me everything. So
Okay,
yeah,
I'm sorry.
Mel, Melanie, Michelle, Melissa. My legal name is Melanie, but you can call me.
Okay, we're just this lady over here. You can contact her. We'll put it. We'll put a little link to your website,
Sure.
and then if you have questions or if you want to have her come and poke ya, she could do that. Well, of course, it depends on where you live. If you live in the U.S., maybe not so much.
No, but any surrounding area of Toronto.
Any surrounding area of Toronto. So there you have it. Okay, guys, oh, wait, what's this say? Can you talk for just a minute about Fragment Injection sites? Ah, very
Okay.
good. Love that.
So Fragment, I'm just seeing the next. This is a friend of mine.
Okay.
So Fragment is a blood thinner. So one of the things, it comes usually preloaded in a syringe. And the key behind doing a Fragment injection, it's a subcutaneous injection for one, so into the tummy, and you're going to follow the same type of, what's the word I'm looking for? I'm completely blank. But you're going to follow the same steps that you would for any kind of subcutaneous injection. So if you've done needles into your tummy for your IVF cycle, then what you're going to do is follow those same things. So cleaning the area with an alcohol swab, and then 2 to 3 fingers on either side of the belly button. And then you're just going to pinch the skin, needle goes in. But with these preloaded syringes, what happens is that when you push the plunger down, it will actually, once you've completed the injection, it retracts the needle back up.
Right.
So rather than pull a needle out yourself, it does it so quickly that if you're lucky enough to have a preloaded Fragment syringe, you push the medication in, the needle will retract once the injection is complete. The key behind Fragment, because I've seen people with massive bruises.
Totally.
You don't want to press really hard. Just a gentle touch, because you're going to find that if you press really hard, you're going to end up with, if you do it with your thumb, you're going to end up with that type of size
bruise.
or
Yes.
bigger bruise.
Oh my gosh.
So very gently, just either with a cotton swab or something, just right on top of where you've done it, just as gentle as you can. Don't apply the pressure.
That's
Unless you're bleeding
excellent tip.
excessively.
And I've seen that too.
Yeah.
Eesh.
And if you do, then that's when you're going to have to really apply the pressure, but then expect a big bruise.
Yeah, but wouldn't you also tell your doctor and say, hey, I think I'm a little too thin?
Yeah.
Right?
I mean, and then they might have to do some blood work, and they may need to reduce the dose.
Exactly.
So those are things, if you find that you're bruising, and with any blood thinner, baby aspirin, so ASA 81, Fragment, Lovenox, those things that if they're thinning your blood, you're going to end up bruising more, bleeding more. So paper cuts, you're going to bleed more. If you bang into something, you know, you bang your leg when you're walking past a coffee table or something, you're going to bruise.
Oh, yeah.
So when you're sticking yourself with needles, you're going to bruise. But I find that just gentle pressure after you've done your injection, fragment injection or blood thinner injection, that should help to minimize. But unfortunately, the bruising is a very normal part of whatever form of blood thinner that you're taking. It's a very normal part of, or one of the side effects.
And it's a stinging one, too.
And it stings.
So I don't think, no matter how good you're doing it,
it's
still
going to sting. Exactly.
There you go.
Yeah.
There you have it. Okay. Yeah. I hope that helps. And again, thank you.
You're very welcome. Thank you again for having me.
Oh, love it.
Now I know where you live. So
now you know. Oh boy, don't stalk me. Okay.
Yeah.
So here it is. But I'm gonna let her poke my butt next time and the belly. I do that for you guys. Oh.
Yeah.
What do
I'll
you
be
do?
happy to do that for you.
Get your aggression out.
That's it.
Okay. Awesome. Okay. Have a great night, guys.
Thank you.
Take care. Share it with your friends.
Bye.
Oh, and if you haven't done so already, please pick up my book, Pathways to Pregnancy. There's 15 stories of hope. One of them is my own personal story because, as you can tell, I went through a fertility journey myself. And Mel was one of the people who helped me. So have a great night. We'll talk to you next time, okay? 8:30 p.m. Eastern Standard Time on a Wednesday night. Well, every Wednesday night. Okay, take care. Happy New Year's, by the way. Bye.
Bye.